Hi, who is here? Please let me know who's here with me practicing yoga today. I like when I know who's here because then I can direct the practice to those who need it. Terry, hello. So good to see you, Terry. Nice that you're here. And it's great when I do my Ask Me Anythings and I have the video because then I can see everyone. And I like that when I can actually see who I'm speaking to, know who's there. All right. So, Beth, our regulars, right? Here we are, ladies. You know, I have to be honest. Today I was like, oh my gosh, I've got so much going on in my life. And it was like so much to get here. And then I'm like, you know what, Debbie, but this is what keeps you strong. This is what keeps you out of pain. This is what allows you to travel the way you do and live the life that you live. So every day showing up to the mat is really important. And happy to be here. All right, who else? Esta, great. Happy to have you here. Claudia, happy to be here too. And especially because I know Terry does not live here. Beth does not live here, meaning in Los Angeles. So how else could we do this if we didn't have this access of the internet? So that's important. Lynn, hi. Are you new to me? Will you say again? And you might have been here. And Lynn, I'm so sorry if you were, because I'll tell you, it's my mind. I don't know what it is. Is it aging or is it all the stuff I have in my mind with what I'm taking on these days? I'm not sure, but whatever it is, my memory is not quite what it used to be. So yes, as in first time, right? And if it is, can you tell me anything in particular about you that I should know so that I could help direct? Information overload. It's so true, Claudia. And you know what? It doesn't just exist for me, because out there in the world, especially the bone health world, what I'm noticing, you know, I've been in this space for a long time. I would say that 2010 or 11 is when I started to become very aware of bones, in my 40s with my hip issue. And then, of course, having a DEXA scan at like 49 or 50, doctor said nothing to worry about. I don't even have the results that baseline. But what I do have over the next 2 years, every 2 years, are my DEXA scans. My worst one ever being negative 2.4 at the age of 53 in my hip. And then I reversed that to negative 1.9 2 years later. And so, yeah, really interesting, this whole information overload, because there's a lot of players that are coming into the space because it is a space that has a lot of desperation. When you get a diagnosis of osteoporosis or osteopenia, you start to look for, oh my gosh, what should I or could I do? And then you start to see, well, there's a vibration plate, and should you get a weighted vest? And should you join this program for $200 a month or this one for $300 a month? Should you be doing extra weight and weight bearing exercises? And if so, how much? And wait, who should guide you during that? Can you do it yourself? Is it safe to do that? And that is what exists. Oh, and then supplements. Should I take supplements? If so, which ones? Should I be taking calcium? Should I be taking strontium? And so then it opens up this whole world. And then there's this program this doctor is doing for $9,000. Do I need that? No. Most of those things I'm going to say no. We need our body. We need our weight bearing, which is what we do in yoga. We need to eat the right foods. Yes, we need some supplementation, and we need to focus on removing triggers of inflammation. And that is what we need to do. And that doesn't have to cost an arm and a leg to do it. So that's what I'm doing, is sharing that information. And we'll do this, do it ourselves. All right, let me see. Got to put the glasses on for this. All right. I have a lot going on, Esta, because I feel like I'm up against a lot out there. And the more I see happening, I'm like, oh no, wait, no weighted vests. You know, I was talking to someone about weighted vests. If you had a perfectly aligned spine, you don't need extra weight. Most do not have a perfectly aligned spine or even know what that means. And if you don't know what that means, and then you put extra weight on improper posture, you're contributing more force to the place that the spine fractures. So I am not a proponent of weighted vests. We do not need them. It's extra weight for nothing, and could be dangerous. Most people are not properly aligned. So, and you know, if I think about what that means to take on a weighted vest, God, that's so much extra weight and so much hope, and in a way suffering for what? We have to learn how to do all the right things, and there are right things, and that is what I'm here to do. Claudia, yes, information overload. Joan, nice to have you. Dr. Bush, oh my God. Well, I love Dr. Bush. We are partners. We speak weekly. He's a big part of what's going to help me on my mission, help this be affordable for women. So I say I create affordable, physician recommended programming for women to be in control of their bone health. And that's what we can do. So this right here, yoga therapy, is one start. Back rods, so back does not bend, but all else works. Osteoporosis too. Back rods, meaning you had that surgery with the back rods. That's a whole other thing. The way we treat spinal issues, and then we get surgery and we put rods in our back, or we fuse things to make our backs not move. So, and whatever we have, we have. So let's do this. Let me introduce myself. I am Debbie Robinson, yoga therapist, bone health expert, functional bone health expert, because I run functional labs to look at internal imbalance, and I use yoga therapy to get mental emotional balance and to get external balance. Can I stand on one leg and not fall over and fracture a bone? So balance is the key. We need balance everywhere for our bone health. And that is how we focus on bone building and we stop bone dissolving. I had a hip replacement in my left hip. This is my left hip when I was 51 years old. And I was 1 point away from osteoporosis at 53. Reversed it, turned it around, not going to let it happen. And that is what I am here to help you do. So you will hear me speak. I have been specializing in bone health since the early 2010-ish timeframe. I've observed thousands of bodies move with yoga. I will be your guide. I will direct you. You will hear my voice. And the voice I want you to listen to the most is the voice inside your body. So when I'm explaining something, if you see me do it, I'm bending deeper or holding longer. If it's not for you, then you come out earlier, because safe, strong stimulation is the key to building our bones, our balance, and our body. So you do what's appropriate for you. There are some props we need when we practice yoga for bone health, and really yoga in general, whether that's the focus for someone or not. Having a blanket is really a standard prop. And if you don't have some of these other props, then get 2 blankets. You could also get pillows to help you as well. So a blanket will be something that we need. And then we also need at least 1 block. Today, if you could get 2 blocks, I'd like you to get 2. And a strap. Now the strap could be from your robe, it could be from a belt. Ideally getting a strap, they're not very expensive. I highly recommend that. This here is a 10-foot strap. Most of the ones you find out there are going to be 6 foot, but whatever you can get is good. So having a strap, having at least 1 block, and having a blanket is going to be important for today's practice. And then I'd like you to have a chair handy if balance is an issue for you, or a wall handy if balance is an issue for you, because that can be very supportive of your practice. And then again, you do whatever you can do. Anything and everything is perfect. So bring yourself at first. Let's begin in a seated position. So there's a couple of things we could do here. If you have pillows and you like to be propped up higher, if you have issues in your hips, your low back, the higher you go, the less pulling will happen in your joints. That might be a little bit better for you. If you have a blanket, folding it double may be enough for many of you. And then depending on the size of your tushy, you may be able to sit on a block. Blocks are not that big. So if this is a little bit too small for you, you could use pillows. But if you sit on a block and you get elevated, that's nice to do as well. So just choose what's best for you, for your body. And then come into a seated position. You could also sit in a chair. You could sit without anything. Just really depends on what your practice allows for you. When you come into a seated position, if you pull back the flesh of the buttocks, pulling back the flesh of the buttocks, now you'll feel your sits bones. And when we feel that, that's actually a nice position to get that nice alignment in the body. When we have perfectly aligned joints, When our bones are stacked, that's when we minimize wear and tear. It's also the position to be in to create the maximum forces that support bone building. So coming into this nice seated position, and then you may notice some things here. So close your eyes. Now, when we are in a seated position, the kneecaps are out to the side. This is external rotation in the hips. It could be a little issue if you have issues in your tissues. So if you have knee issues or hip issues or low back issues, I want you to close your eyes and bring your awareness to your lower body and pay attention to how you feel here. Noticing what's happening in your body. Do you feel any pulling or any sensations in the low back area? Now slide your hands back so your elbows are right underneath your shoulders. That's a nice aligned position for the shoulder joint. And then using your hands, you could push away with your hands so that your spine is erect, growing right out of your pelvis. Mouth is closed, wiggle your jaw side to side as far as you can, and then open and close your mouth really wide. The topic of today's practice is managing stress. Stress is held in our jaw. You've heard of teeth clenching. Some of you may have been told by your dentist that you grind your teeth at night. So the mouth area is directly connected all the way down to the pelvic floor, and the whole entire internal body is connected through fascia. And when we are consciously or subconsciously stressed, there are things that happen in the jaw. So relax the lower jaw. Let the tongue rest where the roof of the mouth and the top teeth meet. And this will separate the back teeth. Let your eyes be closed and turn on your inner eyeballs. Let your mind go throughout your body, noticing here, do you feel tension in your hip joints? Can you release wherever you feel the tension? Bring your awareness there and let it soften. Can you release the low back? Noticing holding patterns of you in this seated position. And then gently push your torso back an inch at a time so that you are more aligned right out of your pelvis. With the eyes closed, is your head forward or is it coming right off the top of your spine? Elbows are underneath your shoulders. You may need to push your arms back a little. This will bring the shoulder blades back onto the upper back. When the shoulder blades are in this position, it activates the upper back support muscles for posture. Take your palms, turn your palms up towards the sky, press the backs of the hands into your thighs. Elbows are underneath your shoulders, eyes are closed. Internal body awareness is how we will heal ourselves. It's how we will create the most effective and strongest bone stimulation. And it's how we become aware of our body, because this is your body and these are your bones. And you have everything you need through how you think, how you move, and what you eat every single day to create the strongest, most fracture-resistant bones possible. Push down with your hands, up with your spine, lift your heart, and then gently open your eyes. So I want you to notice if you're feeling discomfort here. If you're able to sit here, stay here. We're going to do a breathing technique to help regulate the nervous system. And if you're feeling uncomfortable and you need to shift your body position, you could do so. If you want to take your legs out and unkink the hoses, take the bend out of your knees, bend out of your hips, and then come back into the crisscross leg position. Or if you want to change your position, change your position. So we're going to do a breathing technique called 4-7-8 relaxing breath. And Dr. Andrew Weil is a functional medicine physician. And when I saw him speak in about 2008, 2009, he said this is a breathing technique he teaches all around the world wherever he goes and travels to hospitals. He teaches the patients, he teaches the staff. It's called 4-7-8 relaxing breath. It's a short breath. You do this for a month until you get used to this, and then you can add on extra rounds if you'd like. We're going to begin with 4 rounds. And this is what Dr. Weil recommends. We begin with 4 rounds. And then after about a month practicing, you can add on extra rounds if you'd like. So we want to make sure that our body feels safe here. Take the left hand and put the left elbow underneath your shoulder and the left palm up towards the sky. This puts the shoulder joint into a nice deep position and a relaxed position. So if you have shoulder issues, this position here, palms up, elbows underneath your shoulders, is a good position for the shoulder joint. And then the right hand as well. So take your elbows alongside your body and take your hands up. If you need to support your body a different way, you could also hold on to your knees here and do what you'd like. Now I'd like you to take your tongue and make a taco shape. Now some of you are not able to do that. Try to see if you could curl your tongue like a taco. And then place the tongue. I just wanted to see just a little piece of awareness there for that. Now take your tongue and everyone press your tongue where the roof of the mouth and the top teeth meet. And then I want you to open your mouth on your exhale. Feel how that slows the breath down. Feel how there's an audible sound. As you exhale, the mouth is slightly open, the tongue is pressing to where the roof of the mouth and the top of the teeth meet. So the mouth is open on the exhale. That's what we're going to do in our exhale. The way this breath goes is we inhale for a count of 4, we hold for a count of 7, and we exhale for a count of 8. We'll do 4 rounds of that. I will talk you through the whole thing. So I want you to close your eyes. Take your tongue and put your tongue where the roof of the mouth and the top teeth meet. Practice inhaling with your mouth closed. And practice exhaling as you open up the sides of your mouth. And notice that sound. Do that a couple more times. And then one more time. So I'm going to guide you through 4 rounds of this. Keep your eyes closed. Feel your body, push your torso back, chin parallel towards the ground. Elbows are either underneath the shoulders, palms up, or hold on to your knees, finding as comfortable of a seated position as possible. And then let's begin. Take a big exhale. And begin. Mouth closed. Inhale, 2, 3, 4. Hold your breath. 2, 3, 4, 5, 6, 7. Open your mouth. Exhale, 2, 3, 4, 5, 6, 7, 8. Inhale, 2, 3, 4. Hold. 2, 3, 4, 5, 6, 7. Exhale, 2, 3, 4, 5, 6, 7, 8. Inhale, 2, 3, 4. Hold. 2, 3, 4, 5, 6, 7. Exhale, 2, 3, 4, 5, 6, 7, 8. Last one. Inhale, 2, 3, 4. Hold. 2, 3, 4, 5, 6, 7. Exhale, 2, 3, 4, 5, 6, 7, 8. Keep your mouth closed. Relax your tongue in your lower jaw. Breathing in and out through your nose. Notice your heartbeat. Notice how your body feels. And then gently bring your awareness to your eyelids. Allow them to blink open. So don't just pop your eyes open. Allow them to blink. Noticing if you were able to stimulate a heaviness in your eyelids, a relaxation in your body. When we trigger or stimulate or turn on the parasympathetic nervous system, that's where bone building takes place. The opposite part of the nervous system, the sympathetic branch, the fight, flight, I gotta go, I gotta do, is where bone dissolving takes place. So we need to find this internal balance of bone building and bone dissolving. Bone dissolving is necessary for cleanup, and it's necessary for short-term stress response if you need to do something. But in the long run, long term, it actually dissolves our bones, leading to osteopenia and osteoporosis. So 4, 7, 8, relaxing breath. Add that to your treasure chest of healthy aging and healthy bone tools. So we're gonna come down and we're gonna do a supported back bend. Now, this shape here is what we wanna minimize in our lives. And we want more of this, the back bending shape. So come here onto your blanket. And we're gonna learn something that we're gonna use throughout the whole practice and then take off of our mat and use into our lives to protect our spine for the rest of our lives. So take one hand and put one hand underneath your heart, palm down. Take the other hand at the belly button, palm up. Now, if we measure this space here, it's about 8 inches, 7 or 8 inches, this space. It's called the safe spinal space, this area here. You're gonna maintain this space throughout the practice today and when you get up off the mat for the rest of your life. This space here, you wanna make sure you don't bring the fingers closer, the hands closer. And what would do that is bending your spine, flexing your spine. And the reason for this is this area here is where almost all of the spinal fractures are. Thoracic 8, 9, 10, 11, 12, lumbar 1 and 2, right here. It's because of the forward or anterior pressure on the front of the vertebra, which is mostly spongy bone and not bone to withstand the pressure of gravity on the front part. So this here, this distance, this physical distance, maintain this throughout your practice. We're gonna do a lot to open up, to stretch, to create more stretch and more space here. And the first posture is gonna do that. So I have 2 blocks. If you have 2 blocks, one of them is gonna go for your head and one of them is gonna go behind your heart. So if you have 2 blocks, that's the way you would set up yourself. If you only have 1 block, you could put 1 block for your head, and actually that one here, I'll put that behind the heart. Now, this is a stronger posture because it's behind the shoulder blades, and so I'll give you a softer one if you need that. That right here, if you were gonna have that, the heart goes here, the head goes there. So either 2 blocks, or if you are needing to be a little bit more gentle with your body, I would take the blanket and put the blanket into thirds and put that under your heart and put your head on the ground. So something to manipulate this part of your spine here in a back bend. So you choose whatever it is you're gonna do. We're gonna come down, be there for a few minutes to allow the muscles of posture, spinal muscles, shoulder muscles, and chest muscles to start to open. And then as you come down in whatever you've chosen, maintain your safe spinal space. So you do not roll down like this, where you're pressing short in front of your body. You stay nice and tall, nice and long in your safe spinal space. The prop, whether it's a blanket or a block, is behind your heart. So put it behind your heart. You want to accentuate this rainbow shape in your spine. The block behind your head is for you, depending on where you are in terms of tightness in your body, range of motion in your spine. You don't want to be too high with the block. You want to manipulate the area right behind the heart. This is where the least flexible part of your spine is. And then the arms add to this. So take the arms out to the side, either long or bending your elbows. And you determine here what you need to do. Now, if you have rotator cuff tears or issues in your shoulders, or if you have spinal surgeries where you are not just supposed to be doing anything, if you have anything you should not be doing, I want you to take that into account as well. You are your own chiropractor. You are your own yoga therapist. You're in charge of your body, so do what's appropriate for you. Put yourself in whatever body position you need to feel the stretch in the chest muscles especially, and in the front of the shoulders, and in the part of your body where your arms attach. It's a good idea to keep your knees bent, feet flat. It'll help to minimize the pulling on the low back. Keep your mouth closed and focus on breathing here. Deep breaths down to your belly. Keep breathing. Breathe to your heart or breathe to your belly. And then if you're able to move your arms wider, higher, farther away, the pectoral, the chest muscles play a very important role in spinal health and fall prevention, fracture prevention. These are the muscles in the front of the body that tighten with our forward movement throughout the day, knitting, computering, texting. So paying attention to opening up, to stretching this part of the body. And then we're also stretching the spine, and we are stretching the front of the body, so we're gently pulling on the ribs. Ribs are one of the areas to focus on where fractures can occur. So as we pull on bones, we are stressing them appropriately to be stronger for us. We are stretching muscles, which is also going to create stimulation to add more strength to our muscles. Stronger muscles equals stronger bones. Mouth is closed, breathe into your body to accentuate the stretch. And then finishing the breath you're on, take 3 more breaths. And at the end of that 3rd breath, give the breath back to your body. If you are able to come into a fully outstretched position, go slow. Notice that the low back is okay with this, depending on how you've manipulated your spine with the prop. Take your arms overhead, your feet long, and stretch your body. Try to pull the rib cage away from the pelvis, stretching the middle part of the body where the stabilizing muscles are, the core muscles, the low back muscles. These are important muscles for bone health, for fall prevention, and for keeping your spine and your alignment perfect so that we can create a healthy spine and also more stimulation to the bones. Take 1 more breath. And then bring yourself into a bent knee position. We're going to come off this prop. So come off all the way. So you cradle your head in your arm and you allow your spine to go into a different position here. Now, this is another piece of awareness. We want to push away from the floor to keep our chest and shoulder muscles strong. More skeletal muscle, lean skeletal muscle equals stronger bones. So we have the opportunity to stretch, strengthen our chest muscles and shoulder muscles by pushing away from the floor instead of pulling up with our head. So look towards the floor and use your elbow and heel of the hand to push yourself up, keeping the upper body nice and strong. And then clear your space, move your props off to the side, get your blanket, bring your blanket onto the mat. If you do have socks on, if you're able to take them off, so you get this nice feeling of your feet in the floor. Coming on to all fours, another area that's important is wrist strength and wrist flexibility and range of motion for fracture risk. So walk your hands forward so that you have your hands as far away from your knees as the length of your torso. You don't want to be too short in your stature here. And if you can, get your pointer fingers forward, spreading the fingers here, coming into an all fours position. The hands are underneath the shoulders for perfect alignment. The knees are underneath the pelvis. And then your head is looking forward. Don't let your head hang here. And then look a little farther forward, about 3 feet in front of your mat. You're gonna start to feel the burning in the upper back and neck muscles. This is strengthening postural muscles, critical for bone health, for healthy aging. Press your fingertips into the floor, and I want you to push yourself side to side. So push your whole hip complex, your pelvis, and your torso side to side. Feel that stretch coming into the side of your pelvis. Keep your head lifted. Keep checking yourself. Every time you lower your head, bring it back up and keep activating those muscles of posture in the upper back and neck. Bring yourself back to center. Push yourself back as you lengthen your glutes, starting to stretch the glutes. And then bring yourself forward, weight bearing in the wrist. Go a little farther forward and back. So on the mat, in the yoga therapy class, we stress the bones, stress the joints, Increase the range of motion and flexibility so that if you do slip, trip, stumble, or fall and you put your hand down to break your fall, we need the wrist to bend and not pull on the bone and fracture it in the lower arm bone. We also need to weight bear here to have stronger hands, stronger wrists, stronger forearms. This is the number one site of women over age 65 to fracture is the wrist. Keep your head lifted. And then bring yourself back to center, bring yourself all the way up, take the wrist, roll the wrist. So if you have wrist issues, do what you can do. And don't stop doing something in your body because you have an issue or an injury. Learn how to slowly and surely and safely build back up flexibility, range of motion, and strength. Take your hands open and close. Wrist strength or grip strength is linked to risk of fracture. So keep your hands mobile, keep your wrists mobile. We're gonna come into our first posture, plank, which is a total front body strengthener. If you can do this with straight arms, then you would come into the full plank. If you need to go down on the forearms and do the modification on forearms, or if you need to modify by keeping your knees and your shins on the floor, do that. Walk your hands forward. So if you're gonna do the modification, walk your hands forward, so your whole pelvis comes forward and your core needs to manage this in space. Don't hammock your body. Keep your low back lifting up towards the sky. And if you're gonna come into the full variation, flip your toes under and lift your knees off the floor. Spread your hands a lot and push back through the heels, bending the toes. Make sure all 5 toes on both feet bend, not just the big toe or the second toe. And then spread your fingers, push your fingers into the floor. So you can stay here in the regular plank or do a 3-legged plank, lifting 1 foot off the floor for a breath or 2. Depending on where you are in your body, in your strength, and then switch if you're gonna do the 3-legged plank. Choose what's appropriate for you. Both legs down, really push through, push away from the floor with your feet, push away from the floor with your hands, take 1 more breath. And then bring yourself out. Come into a rest position after the posture, especially if you chose a really challenging one for yourself. Close your eyes. Close your mouth, close your eyes, catch your breath, notice if your heart rate accelerated. And then take 1 more breath. And then open your eyes. The more muscles you use, the stronger the posture is, the more likely your heart rate will accelerate. And then take that time to relax in between. So we're on the blanket. Take your knees back so you're at the back edge of the blanket. Bring your hands forward. Keep your head active. Come forward. And then bring yourself down onto your forearms. And from here, lower your pelvis towards the ground. Take your body back so that your pelvis is on top of the blanket and come up in here in what is called Sphinx pose. So the elbows are directly underneath your shoulders. Make sure your elbows are not out to the side. So the elbows are only about 8 inches apart. Spread your fingers. Push your arms into the ground and feel like you're dragging your arms back towards your body so you could push your torso forward, push your heart forward, and push away from the ground. Look up halfway across the wall, either halfway up from the floor or even higher. Feel that stretch in the belly as you push away from the floor, push your heart forward, stretching the front of your body. Toenails touch the ground. And if your low back is unhappy, spread your legs a little wider. Take an exhale. Now as you inhale, lift your nose up and to the side, stretching the upper back and neck muscles, as if you were sniffing an aroma in the air, and then bring yourself back to neutral on the exhale. Inhale, up and back. Try to keep the head lifting up the whole time as you look, and notice, where is the tension? Notice what's happening in the front of your torso. Strengthening your elbows here, your arm bones, your shoulders, stretching the front of your body. Inhale. This is good for posture, good for spinal health. And then bring yourself back to center. We're going to come all the way down to the ground. Push your hands into the ground and lengthen your body to bring yourself down onto the ground. Take your arms out to the side. Elbows come right off the shoulders. Palms touch the floor. Walk your toes together. Let your forehead touch the ground. Exhale. As you inhale, imagine you're pushing a marble away with your nose. Your head comes off the ground. You start to peel the front of your spine away from the ground, pushing your arms into the ground, and exhale to lower. Close your eyes. You're bending your spine starting at the top where it attaches to the skull. There's 7 neck bones. And then you start to move into the thoracic where the ribs are. You're activating the muscles of the back that attach to the skull and the pelvis. And we're shortening those muscles to lift that head of yours up against gravity. The average head is about 10 pounds. Go slow with this. Close your eyes. Feel all the parts of you that stretch. One more. And then bring yourself down. Warming up the back, we're going to come into the locust posture. So take your arms alongside your body. We're going to bend our spine from the base of the skull all the way down to the tailbone. We want to make a smiley face with the back. So let your forehead touch the floor, the big toes touch, push your feet into the floor, the kneecaps are active away from the ground. Exhale. As you inhale, push a marble away with your nose, peel your head off, your front torso, lift your hands up, and then lift your legs off the floor. This is locust. Long from crown of head to the tips of the toes. Reach long with your fingers, slide the shoulder blades at the back of your body towards each other. Push your heart forward, bending your spine like a smiley face, stretching the front of the body and contracting the back. The base of your skull down your spine to your tailbone. Those are rector muscles. Very important for bending properly in our body, keeping our body and our bones safe. Reach long with your fingers, reach up with your head. Bring your awareness to the back of your spine. Push the back of the bones into themselves, stretching open the front of the spine. Big breaths to your belly. And if you'd like, you could squeeze your tushy cheeks, activate your glutes to protect your low back. Take one more breath. And then bring your arms out to the side. Fold your hands one on top of the other. Take your legs wide. Place your forehead on the back of your hands and then bend your knees. Let your feet gently flop side to side to relax the tension in the low back. Breathe down to your belly. Keep your mouth closed. Breathe in and out through your nose. Relax the lower back. Big breaths to your lower belly. Take one more breath. And then let your legs go down. Bring one arm long and roll onto that side. Cradle your head in your hand, bend your knees. Using the elbow and the hand to push away. Using those upper body muscles to bring yourself up to seated. So take your blanket and fold your blanket in two at the top of your mat. Now, if you are tight in your body, you may need to fold it again. And get your strap and get your block. So I'm going to come into some posture and some spinal strengthening postures here. So postures for posture and postures for the spine. So sit at the very front edge of your blanket, reach under, grab the flesh. So moving the muscles back will actually expose the pelvic bones and allow you to sit nice and tall. Take your strap and make sure you maintain that safe spinal space. So you don't want to flex forward in your spine to reach your feet. You want to capture your feet with your strap, keeping your spine nice and erect. We're going to do, it's called Dandasana or staff pose. It is a pose of posture, getting this nice 90-degree flexion in the hip. Take your hands on the strap, wrap your hands around the strap, and slide your hands back so that your elbows come underneath your shoulders. Look at your feet, separate your feet about 2 inches. Push into the pinky toe edge of the strap. Push down with your calves, down with your heel, down with the back of the thighs, and sit as tall as you can. Be active in this. This is an active posture. So pulling back with the strap, pushing your feet into the sides, pulling your toes towards you, heels down, calves down, thighs down, elbows in at your waist and back far. Push the shoulders away from your ears, slide the shoulder blades towards each other, and slide the shoulder blades down the back of your body. So keeping your body active here. Push into the strap, push down, sit up. Now you can stay here using the strap, or if you let go of the strap, maintain this posture with the arms out to the side. Keeping the shoulders away from the ears, sliding the shoulder blades towards each other, down the back. Heart is lifted, head is lifted, toes are pulling towards you. Push your heels down, push your calves down, push the backs of the legs down. Strengthening the front body, the hip flexor muscle group, strengthening the upper back, the spinal muscles, the postural muscles for fall prevention, fracture prevention. Take one more breath. And then slowly release. Do not collapse your spine. Stay nice and tall. Take your strap off to the side and bring the soles of the feet together in bound angle pose. Holding on to your lower legs nice and tall in your spine, and then stretching the inner thighs. Feel that stretch here, pulling on the pelvis, starting to stretch the inner thighs. So when we do the standing part of the practice, your body will be warmed up, and that's how we keep ourselves safe as we do the standing or some of the deeper stretches. Take one more breath. And then bring yourself out. We're going to practice a seated twist. Now, twisting is one of the best ways to create stimulation to the spine. The most important thing when you twist is you are not collapsed in your spine. You want to make sure you have that safe spinal space so that you're lengthened, and then you add rotational force. Take your block behind you on the left side of your body and bend your left leg. Make your right leg active, toes are pulling towards you, straight up towards the sky, leg is pushing into the floor. Hold on to that left leg by clasping your hands and pull your torso towards your knee and your knee towards your torso. Hold on to the left leg with the right arm, keep the right elbow lifted, and then take the hand on the floor behind you if you have longer arms, or on the block. Push down with the right leg to get nice and tall. We're going to turn our torso, starting at the lower ribs, the middle ribs, and the upper ribs, trying to add that rotation to the thoracic spine. Exhale. As you inhale, turn your lower ribs, your middle ribs, and your upper ribs to the left. Keep your right elbow active. Push your right leg down. Pull your right toes towards you. Pull your left knee towards your torso. Lower the shoulders, slide the shoulder blades towards each other and down your back. And then push the shoulder blades forward to lift your heart. So keep working in this. Push away from the floor. Don't lean into the floor. Lift your right elbow. Pull the left leg towards the torso. Push away from the floor with the leg in the hand to be as tall as you can, turning and rotating your spine. Breathe deep down into your belly. Pull the toes towards you. Take one more breath. And with length, you're going to unwind, push the block to the other side. Let's go to the other side. Take the left leg straight, active, heel in the floor, leg pushing into the floor, toes towards you. Right leg is bent. Hold on and pull your torso towards that right leg. Take the left hand on the right leg and the right hand on either the floor or the block behind you, so you could push to get length in your spine before you rotate. Push the left leg down, pull the left toes towards you, keep the left arm lifted, exhale. And as you inhale, you turn the lower rib cage, then the middle rib cage, then the upper rib cage to the right. Push down, get tall. Lower your shoulders, slide the shoulder blades towards each other and down your back. And push them forward to lift and lengthen your spine. Left elbow is lifted, left leg is active, right knee is being pulled towards your torso for that length. Shoulders lowered towards each other, down your back, and lifting the heart. Lengthen your spine. Push away from the floor with your hand, with your leg. Keep working. Lower the shoulders, slide the shoulder blades towards each other, push them forward to lift your heart. Take one more breath. Keep yourself nice and tall as you lift up and you bring yourself back to center. We're going to come into a wider stretch here in the inner thighs. Take your legs wide. Come to the front edge of your blanket. And then to go deeper if you want, it's the whole torso moves, not the spine. Don't bend your spine to go down. That's going to collapse that safe spinal space. We need to maintain that safe spinal space. If you go deeper, it's because you bend at your hip joint, not in your spine. And this is where it's safe to move with osteoporosis or osteopenia, is in the hip when you bend forward and not in the spine. And you may notice that you're having a strong sensation here in the inner thighs, or maybe even in the back of the legs. Take one more breath. And then bring yourself all the way up and all the way out. Take your blanket. Bring your blanket onto the middle part of the mat. Come onto all fours. So we're going to come to standing. I'd like to guide you through this. You want to go slow because your blood vessels need time to prepare from being down low to standing up. And as we age, we see wrinkles on the outside. We actually have wrinkles on the inside. There's less pliability in your blood vessels as we age. So going slower, giving your blood pressure time to calibrate is an important thing for fall prevention. Take your hands wide. Take your knees wide and take your feet wide and bend your toes under. If you do need to get up a different way, of course, go slow and do that. But this is a little bit of a strengthening hip joint way to come up. So you're going to look back. You want to not see your toes when you look through your knees. So you're that wide with your feet. Push yourself back and lift your pelvis up. Look forward with your head. And push one heel at a time towards the floor, stretching the back of your body, stretching your calf muscles. Push both feet down towards the floor. Keep your head forward as you start to walk your hands back until your feet touch the floor and your heels touch the floor. Keep your head forward, keep your spine long. Bring one hand at a time on top of your thighs and stay low here in your hips. You're looking forward. If you could rock back and lift your toes up, if you could lower your buttocks going deeper in that hip bend. You could keep your forearms here, or you could bring your arms in front of you. Lifting your toes up, bring your awareness to your feet. Feel like you're trying to rip them apart from each other. You're trying to rip your mat right down the middle with your feet. Push down and push out. Take one more breath. And then slowly unbend your hip, unbend your knees, and bring yourself up. Deep breaths, keep your mouth closed, breathe in through your nose. So we're going to clear our space, making sure the bend occurs in our hips, not in our spine. This is unsafe. This is safe. So before we bend down, take your hips, bend your hips, push your tushy back. Wide stance. You're pushing your tushy back to bend. learning how to keep that isolated in the hips. Think about that throughout your day, maintaining that safe spinal space the whole time versus bending with your spine. You're gonna bend down and clear your space, bending deep into your hips to do that. Blanket off to the side. Keep your block to the side. So if you need to get a wall or a chair, go ahead and do that. And then let's come into the alignment position in standing. It's called Tadasana Mountain. So the feet are about an inch or two apart here. Lifting your toes, press the ball of the foot into the floor. Pinky toe edge in the heels. Lifting the toes up and then press the toes down. Take your hands alongside your body. Reach down with your hands and back with your hands. This is an active posture. Push your toes in, the ball of the foot, both pinky toe edges, both heels. Push the top thighs back, squeeze the tushy and pull the tailbone down in between the ankles. Lift your heart, push your ears away from your shoulders, push your hands back, look straight ahead, push your head back. This is called Tadasana Mountain. So this is stacking your joints, finding that alignment, and then noticing where do you feel the tightness in your body? Where do you feel the need for extra attention? So quite often you'll feel a burning in between the shoulder blades or in between the lower skull and the top of the shoulder blades. The upper back and neck muscles work hard to hold your head up all day long. So noticing here in your body. Take one more breath. So from this aligned position, we'll move into balance, challenging ourselves with balance. If you have a weaker side, you could go there first, pushing yourself to one side, bend the opposite knee, keep the toes bent. Keep the pelvis forward as we push the knee out to the side and bring the foot up. Either you could put the foot on the floor, heel next to the lower leg bone, or the toes on top of the foot, push the heel against your lower leg bone, or bring your foot up in between your ankle and your knee. Reach down with your hands, back with your hands. So this is tree. Stay here or challenge yourself, either moving your arms into different positions. And if you are pretty secure in your tree and you want to add more challenge, then head position would be the next. So even taking your head to slightly look up above you is quite a challenge. Or side to side. Remember, do what's appropriate for you. One way is appropriate for you. Strengthening our balance, really important for bone health. Take one more breath. Bring yourself out. Dismount gracefully with control. Take your hands down, back to mountain, align your feet. Toes, balls of the feet, pinky toe edge, heels. Top thighs back, chest lifted, shoulders away from the ears. And with this alignment to the other side we go. To the side, bending the knee, bending the feet. Knee out to the side, bring the foot up in between the ankle and the knee. Here, the challenge is whatever you need it to be. It may be that your arms go into a different position. It may be that you start to move your head, or you may not. Do what's appropriate for you. It's your practice. Take one more breath. And then bring yourself out, bring yourself all the way down, and shake your legs. So we're going to come into triangle using the block for this. You could use a chair if you need a chair. You could use the wall if you need a wall. So we're going to go to the left side here. And I'd like to instruct this in a different way than you may have heard this, or maybe you have heard this. The bend is for the hip joint. You want to maintain space on the side. So in between your low ribs and the top pelvis, you want to maintain that distance always to keep your spine nice and long. And the bend is going to happen in the hip. In these postures, we want to stimulate bone growth in the femur bone, the neck of the femur, the pelvis, this whole hip complex. So take your legs as wide as you can. And if balance is an issue for you, having a chair will make you feel some more secure, or a wall will feel more secure. Block is in the left hand. Legs are wide. Pick up your left toes and turn your left toes to the left. Pick up your right heel to the right. The wider the stance, the better. Now start to move your pelvis side to side, feeling that stretch that happens in the body. Take your block in your left hand and keep your block on your leg. Bring your block either above the kneecap or below the kneecap. Push into the block so you keep that space between the left low rib and the right and the left top pelvis. And then bring your right arm in the air. And if you could go a little deeper, go a little deeper. And if you can't, stop where you need to stop, where you can keep that length between the left low ribs and the left top pelvis. So this is not about bending your spine to get down. It has to be in the hip joint. If you could go deeper and bend your hip and still keep that space between the left low rib and the left top pelvis, then you could go a little deeper in your posture by putting your block lower. But if not, if you need to stay higher, stay higher. The goal here is to create that stimulation in the hip that we want to prevent a fracturing, keeping the length and the strength. If you rip the floor apart with your feet, push the right foot to the right, the left foot to the left, especially the pinky toe edges of the feet into the floor, you could get that length in your torso, pulling the left lower ribs away from the left top pelvis. Take one more breath. You bring yourself up and out. Keep your legs nice and long here. Bring your toes back to center. Let's go to the other side. The goal now is the right lower ribs and the right top pelvis stay far away from each other. Right toes up, right toes away from you, left toes back. Take the block, the corner of it above your knee or below your knee. Left hand comes up. You push the pelvis away from you. And if you're able to go a little lower here, maintaining that space, you could keep going down, down, down. If you do get your block on the floor, it's to push away from it, to get that length. Pinky toe edges are ripping apart from each other on the floor. With length in your torso, long spine, rotate up towards the sky. Bring your awareness to the right lower ribs, to the right pelvis. Can you push the pelvis away and pull the ribs away? Keep that space. And then make sure your tushy and your torso are in alignment. You didn't push your tushy back and your torso forward. You should be able to fit between two panes of glass, front and back, without having your chest forward and your tushy back. If it is, then go up a little higher. Rip the floor apart. Take one more breath. You could leave your block there, push your feet into the floor and bring yourself up, bring yourself out, and find Tadasana to realign the body. Deep breaths. Take one more breath. And come into the warrior two, where we're going to load down into our hip, block off to the side. So again, you could use a chair in front of you if balance is an issue, or the wall behind you can be really nice with the warrior two. We take the legs long and wide, going to the left first. Pick up the left toes, turn the left toes away from you. Pick up the right heel, move the right heel away. Let's practice bending into this, warming up the knee, warming up the hip. You're going to inhale, raise your arms, bend the left knee, push the left knee to the left, and push away from the right pinky toe edge. Don't let the arch collapse, and bring yourself out. Push away from the right leg so your body goes straight down, not forward. Make sure you don't go forward with your torso. You want to push away from the back of the right. Your body goes straight down. The bend is deep in the hip and in the knee. And on the next one, I want you to come down and stay here in your warrior two. If your knee is over your ankle, you want to walk that left foot forward. Bring your awareness to the right foot, push the pinky toe edge into the floor, grab the back floor with your toes, push away, bend deeper in that front leg if you can, and now push your left heel into the floor so you activate that glute. Lower the shoulders, slide the shoulder blades towards each other. Push the hands back, push the ears away from your shoulders away from your ears. Keep reaching long with the right hand. You bend deep, your torso goes straight down. And then if you'd like, you can feel like you're ripping the floor apart. Push the right foot to the right, the left foot to the left, as if you're trying to rip the floor down the middle. That'll give you stability in the pelvis and allow you to be long in your spine. Take one more breath. And then bring yourself out. We'll go to the other side. When we do the warrior two, and we move the femur bone away from the body in this position and weight bear in that, that's a lot of extra gravitational force for the femur bone, for the neck of the femur, for the hip complex to manage. And this is how these postures create a lot of strength in the pelvic area, which is so important for our bone health as we age. Lift your toes up on the right foot, move the right foot away, and the left heel up and away. Bending that right knee. The right knee moves to the right when you come down. Don't let it cave in, and make sure your torso doesn't go forward. The way you do that is you push off from the back. If you push off there and you really bend that right hip, then you're going to get the femur bone to move farther away from you than you going over there, and the femur bone is not moving. So inhale up, exhale back. Warming up the joints, the front, in this case right, hip and knee. And then the next one we're going to come and stay. Push away from the left, lower down into this. Push that front heel into the floor, lower the shoulders, shoulder blades towards each other, hands push back. Bring your awareness to the left foot, the pinky toe edge. Push the pinky toe edge into the floor. Feel the heel activate, feel the toes, feel the edge of the pinky toe side of the left foot. Pull back with your left hand so your torso is moving back, and maybe you could bend a little deeper in the right. Right heel pushes in, tall spine, lifted heart. And then ripping the floor apart. Left leg to the left, right leg to the right. Activate those inner thigh muscles. Rip the floor apart, push the pinky toe edge of the left, the right heel, take one more breath, and then bring yourself up, bring yourself out, bring yourself back into the Tadasana, the mountain alignment. So when you start to feel your feet and your ankles working in these postures, then you're doing even more with this, and the feet, keeping the feet strong and limber and reactive, is a very big part of fall prevention and fracture prevention when it comes to bone health. So we'll do one more standing posture. Grab your strap, bend your hips when you do this to get your props. The block goes between your legs, and we'll use the strap. So you want to keep your feet block distance. You want to make sure you're not out to the side, and you want to make sure your feet are not wider than your block. So find this alignment position here, the block between the legs. And then your strap, you could either hold on to your strap like this, or if you do have a loop in your strap, you could push out and hold the strap loop. So you decide what's appropriate for you. When we go back into chair, we sit back into it. We bend the hips, lowering our body, the low body. Look forward. You want to be able to see your entire top foot. Your body weight is back. Push into the strap and then lift your hands up. So you go down with your hips, up with your hands in chair. To protect the low back, squeeze the tushy. Try to minimize that back bend if you need that. Toes are off. Squeezing the block and lifting the arms. Push out on that strap. Deep breaths here in chair. Take one more breath. And then bring yourself up, bring yourself out. Take your block off to the side. Blanket back. We're going to come down to finish some postures on the ground. So coming down, also paying attention to that. If you have a wall, it's nice to use the wall. If you don't have a wall, it's nice to try to come down into a squat. You push the tushy back like you're sitting back, and you bring yourself down into a squat, and from here onto the ground. Making sure you don't flex your spine, closing off that safe spinal space in order to come down. Blanket at the top of the mat. Bring yourself onto your side. Nice long space here. Reach long with your hand and bring yourself all the way down onto the mat. If you have a loop, we're going to do bridge pose with a loop. If you don't have a loop, then just do the bridge without a strap, or you could tie the strap. So take the strap, the loop, and bring your feet through it. Bring it to the top of your thighs, where you have about a fist distance between your legs, so not too wide. This helps to turn on the side body muscles, which allows you to get higher in your pelvis and more of a into itself. So with the bridge pose in bone health, we want to press into the back of the spine here, push away from the ground a lot. The arms stay alongside your body like this to really push the upper arm into the floor to lift the upper rib cage to get as much bend as possible. So take the blanket away from the back of your head, arms alongside your body, lift your shoulder blades up, walk your feet back towards your body, push into the strap. You're going to tilt your pelvis back and now push the feet in, squeeze your tushy, push your pelvis up towards the sky, and then you use the upper arm muscles and the upper arm bones to push into the ground to get more of a back bend to come into your upper body. The weight goes into the upper back, not down into the head and neck. Really try to bend that upper spine. Push out on the strap. Push your arms into the ground. Push your shoulder blades to lift and open up your heart. Squeeze your tushy, push out on the strap, push your pelvis up, push your arms into the ground. Shoulders pressing, helping to facilitate the stretch, the bend. Squeeze your buttocks, push your feet into the floor, push out on the strap. Push your arms in and bend your spine. Take one more breath. When we come down slowly. Lift your heels up, relax the tension in the arms. Start to push the spine down one vertebra at a time. Tilting the pelvis back. Try to push the entire rib cage onto the floor before the pelvis touches, stretching those low back muscles. And bring the blanket back behind your head. Strap off your legs, and we'll do one more posture to stretch the back of the thighs. Pull on the pelvis with a stretch. You're going to need your strap for this. So take your strap and put both feet in the strap up to the sky. Now, having your legs straight is the goal. If you could get your knees straight, even if you need to be farther away from your body to get straight legs. Have your feet be about 8 inches apart and hold on to the right strap in the right hand, left strap in the left hand. Wrap your hands around, walk your hands up to your feet so your arms are straight. Don't hold down here. Walk your arms up to get nice, strong hands. Soles of the feet are up towards the sky, pushing into the sides, and then pull the legs back towards the wall behind you. Try to straighten the legs. Push the knees away from you. If you need to hold up higher, as you come closer, arms are straight. Pull the legs back, push the knees away. The straighter the legs are, then you're pulling on the bones. When we bend the knees, we go into the center of the muscle. When we straighten the joints, we pull on the tendinous part of the muscle where they attach to the bones. And then we pull on the bones. Pull the legs back, push into the pinky toe edges. Lift your head, tuck your chin towards your chest. Pull your legs back, push your knees away. Feel that tension, hopefully where your legs are attached to your body. We're pulling on the pelvis here. So again, we stress the body out, stress the bones out on the mat, and that's what gets them to build. And then we reduce stress by adding range of motion, flexibility to our body. Pull your toes towards you, push out on the strap, take one more breath. And then go ahead and release. Strap off to the side, knees into your chest, and rock side to side. So we're going to come into Shavasana, which is the posture of integration, allowing everything that was practiced today to seep into your cells and become a new memory of strength, of space. Take the legs long, lift your head, lengthen your neck. Your hands can go on your belly or out to your side in Shavasana. Gently begin to deepen your breath. Start to bring movement into your hands and your feet. And then bend the knees. Bend your arms. Draw one knee in at a time. And rock side to side. Come onto your side. Push yourself away from the floor to come up to seated. Bring your hands together. Close your eyes. Bring your hands together at your heart. Press your hands together and press them into your heart. We'll close with a sound, a humming sound to settle what needs to be settled. Take a big exhale. Inhale deeply. Hands to your head, bowing forward in gratitude, bending at the hip, not the spine. Always being aware of that forward folding that happens in your hip joint. Namaste. So we practice on the mat, we learn on the mat, we take that off of the mat. We have this time to slow down, to focus on ourselves, to not allow the distractions of life to come in, to be very body aware. It's called interoception when you focus on your body and move your joints in this safe way. That's how we create the stimulation for stronger muscles, stronger bones, more range of motion for fall prevention, fracture prevention, and to be in control of our body and our bones as we are on our journey of life. All right, so I'd like to hear from some of you, especially if this was your first time with me. I want to know how that was for you. So for those of you that are here, if you have not been with me before, I'd love it if you subscribe to my channel and give me a thumbs up if you like this. And if you have any questions or comments, I'd love to answer them. You're welcome, Esta. Nice to have you here. Anybody, especially I'd like to hear from the new ladies. So Joan or Lynn, if you're still here, I'd like to hear from you. Claudia, you're welcome. Yeah, it's interesting for me because I don't know many of you. I don't know, of course, if I'm teaching live and you're in front of me, then I can modify and guide. But when I don't see anybody, I have to imagine who is this person that is here with me and what do they need. So if you are still here, Lynn or Joan, since it was your first time, I'd love to hear from you if you're still able to talk. So for those of you that, how was that practice? If you were going to rate it, I like to rate my practices strong, stronger, and strongest. So, mellow, a little bit harder, and hardest. What would you say today's practice was? I'd love to know about that. I was trying to count how many postures we did today. Terry, great, good. Nice to hear that. Joan, you're welcome. Stronger. Okay, so strong, stronger, strongest. Perfect. So we're going to be in the middle category there. Yeah. I was trying to think of how many postures we just did. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. It's kind of something I shoot for often. So, and that's because Dr. Fishman has the 12 poses versus osteoporosis. And because of that number, that's kind of where I try to stay. And that was that. Okay, great. All right. Thank you so much. And I will see you. I teach this every Thursday. I will be teaching this class next Thursday. So tune in live or my YouTube channel. If you subscribe, you can go there. There's like 500 plus videos there. My podcast today, Stronger Bones Lifestyle, listen to it, The Biology of Trauma with Dr. Amy Apigian. Really amazing episode. So you can go on your phone and search for Stronger Bones or osteoporosis in the podcasts, and I'll pop up. It's usually one of the near the top of the podcast. Anyway, thanks so much. And I will see you in the next class. Bye-bye.